Welcome to the Hospice of the Valleys annual general meeting for this year. We are joined by members and also some guests, and we're particularly pleased to have Andrew with us as for the first AGM that he's attended as a member. And we're also pleased that we have Stephen Tiley with us, who's representing Gavo. And it may well be that we will receive others, and others will join us as the meeting progresses. As I mentioned previously, the meeting is being recorded and will be available to view after the meeting on the Hospice of the Valleys YouTube channel and website. And finally, we have updated our memorandum and articles with the Charity Commission to allow the annual general meeting and indeed any other general meetings to be held by suitable electronic means. If we then move into the agenda for today, and I would certainly, first of all, in terms of my remarks as chairman of the hospice, give a warm and a special welcome to this year's AGM. Special because we are celebrating our 30th anniversary. Much has happened during 30 years, and I'm sure that the founder, trustees, and members of staff would find great difficulty in recognizing the early hospice to that which now exists in 2021. However, one thing has not altered, and that has been that 30 years ago, it was recognized that there was a need to support people and families as they were facing life-limiting disease, primarily at that time, cancer, and the very specialized care that they needed at the end of life. And it is this recognition which continues to motivate us within the Hospice of the Valleys now, 30 years later. The demand for our intervention grows annually, no longer providing care for those with cancer alone, but we are now there for any patient facing the end of their life, regardless of diagnosis. Indeed, one of the areas of increasing demand continues to be amongst patients and families dealing with a diagnosis of dementia. And this is a continuing concern to us as a board that we cannot respond to the increasing demand placed upon our carrier service at a level that we know is required here in Blaenau na Gwent. Such is the need which increases year by year. So often people don't realize, and by people I mean people working within the government, people working in the local health boards, and indeed within the NHS, that the funding of a hospice service relies primarily on the goodwill and generosity of the local population we serve. As you will be aware, in normal times, we actually receive only a small percentage of statutory funding. The majority of the funding of the hospice service is via our retail business and the generous giving by the people of Blaenau na Gwent. We are continually and consistently restrained in what we would like to provide in terms to meet the needs of patients and families on a day-to-day basis. During 2020, as always, the following priorities were maintained by the board. We continued to plan and develop services carefully, always based on what we found as published research and evidence-based care. We ensured that we worked within clear budgets and budget boundaries, continually ensuring the best value for the money that we received. We continually look to more and more innovative ways of raising income through our retail business and a wide variety of schemes and activities. All this whilst ensuring sound governance as determined by the Charity Commission. As in previous years, the AGM gives me an opportunity of thanking my trustee colleagues who freely give of their time to provide strategic direction to the hospice and indeed sound governance in the way all activities are conducted within the organisation. I'm sure that prior to March 2020, no one could have visualised the position we would face with the onset of the pandemic. Normally, I make reference to the contribution made by staff to the smooth organisation of the hospice. But where on earth do I begin regarding the events of 2020? To begin mentioning individual groups of staff would, I think, be entirely wrong. Because despite working in isolation, whether within a very deserted office block or indeed from home, whether or not staff were furloughed, what became so noticeable was the immense spirit, the team working, and the willingness on behalf of every member of staff to go that extra mile, that despite numerous difficulties, in order to ensure that our patients and families receive the care that they needed, whether in our community, whether in the care homes, or within Sicily and Iron. Care was not compromised during 2020. We adapted. We found new ways of working. Zooming, which many of us had probably never heard of before 2020, became the norm. Indeed, it was interesting to note that whilst we continue to provide the normal services that we provide, we also, when made aware of gaps in the normal service provision by our partners in primary care and indeed in the NHS, I am aware that staff stepped in at all times, ensuring that patients and families remained of our utmost importance. All this in a time and a culture of fear, uncertainty, when staff not only had to deal with coming and working in difficult situations, but also had to cope with their own families, their own children, and their own elderly relatives. I think it's a credit to everyone that during 2020, our sickness and absentee rates remained extremely low. I think that says much to say for the working and the dedication, actually, and I don't use that word lightly, of our staff. The wearing new ways of working were devised. I mentioned Zooming. Telephone conversations became commonplace. The wearing of PPE became commonplace. And for the continuous supply of this equipment, we were grateful to an Iron Bevan Local Health Board, as this relieved us of at least one problem amongst many that we were facing at that time. Years spent previously working closely with our care homes in Blaen y Gwent proved to be invaluable in 2020 as the horrific events of illness and deaths hit that sector. Again, our staff worked closely in the care homes, with care home staff, and also providing the link between patients in care homes and their families who are unable to visit. With this in mind, it was very rewarding early this year to hear that one of our nurses, Nicola Kearney, received the 2021 European European mind, not Welsh, not UK, but European Palliative Care Nurse of the Year award for the work, and it was in recognition of the work that she had undertaken in 2020 within the care homes of Blaenau Gwent. I know Nicola would be the first to say that although she received the award, it was a reflection of how all our staff had pulled together as a team during that first and second wave of the pandemic. Reflecting on 2020, I'm mindful of thanks that need to be noted. Here in the hospice, we have always recognized the importance of working with partners. Nobody, no charity, not even Hospice of the Valleys, can work in isolation. And in particular, we're very mindful of the partnership between the Hospice of the Valleys and the Aneurin Bevan University Health Board. We're mindful of the guidance we receive on a UK basis and a Welsh basis. And indeed, we actively involve ourselves, particularly through Grant and through Jane, our Executive Nurse Director, and through Dylan, our Medical Director, in terms of ensuring that we continually remain abreast to new trends, new ideas, which are being discussed throughout the United Kingdom. And therefore, first of all, mindful of 2020 in particular, I am mindful and wish to thank the Welsh Government. The Welsh Government for COVID funding we received, which certainly was much appreciated, as our ability to raise income through our normal means was very much dented during that year. To Hospice UK, who very quickly realised the seriousness of the financial consequences for hospices in the United Kingdom and negotiated a financial settlement with Westminster, which, as these things do, then found its way through the Welsh Government, hence their ability to assist us. There is always a problem with identifying specific gifts for fear of ignoring somebody, but I would specifically acknowledge the very quick generosity of the Health Foundation, who recognise the financial impact of the pandemic on a charity working within a place such as the Valleys, the Blaenau Gwent Valleys. Also, the Welsh Moon Dance Charity. Both organisations are contributing 25,000 and 28,000 respectively to the hospice, and for this we were extremely grateful. To the local health board for provision of PPE, but I also hope that during the pandemic, the health board was aware of the response made by the hospice when we were requested to help out. And I hope that this will develop further the partnership between Aneurin Bevan Health Board and ourselves, so that together we each recognise the specific and significant strengths that each service can bring to help those patients meeting life-threatening disease and indeed end-of-life care. No one has all the answers. We have to work together in partnership. But it is important we recognise the contribution that each organisation can make, and especially the expertise that hospices have developed over several years. I would thank the people of Blaenau Gwent, whose generosity never fails us. Their support through virtual events, their support in quickly and enthusiastically starting to use our shops immediately we reopened enabled us to develop and deliver an income level over that which we had predicted at the beginning of the 2020 financial year. To our volunteers, a difficult year as our shops closed and other opportunities for volunteering had to cease. But thank you to you all for returning when it was considered safe and supporting all we do. Finally, on a sadder note, during the past year, we learned of the death of a person who very much behind the scenes contributed over many years financially to the hospice, Robin Tudor. Due to his support, to his insight, and to his generosity, we have been enabled to grow as a hospice and to ensure that should a rainy day occur, that with due care and diligence, we would have a degree of financial stability. I sense that that rainy day is going to be very much the situation that we face in the next 2 to 3 years. And so I'm very grateful for all that Robin provided for our organisation. And today, I would just like to end my remarks by remembering Robin and sending our condolences to his daughter and family. Thank you very much. Without any more to do, we come on to the bread and butter of the AGM, and I'm going to ask Heather Bainan, our Head of Finance, to present the financial report, and she will be followed on by Richard Noyle from Baker Noyle Accountants, who undertook our annual audit for us. So Heather, to you.
Yep. Just share my screen now. So as Sue's mentioned, it was a very difficult start to the financial year that we've just been through. We faced very uncertain income streams at the start of the financial year, and we were also looking to reduce costs wherever possible at the start of the year. We also looked then to furlough staff, and our shops had to shut, so it was a very uncertain time for us at the beginning of the year. But despite this, we were very fortunate, as Sue mentioned earlier, that the support of our local community, so we were able to bring in some virtual fundraising and other fundraising throughout the year. We were fortunate to get retail grants, which covered our lost shop income. We had furlough income during the year. With the Welsh Government Hospice emergency funding, which you can see in our accounts, there's over 575,000 that we received during the year. We also, when we were able to, we opened our shops, and we were also able to get good donations in as soon as we were able to receive them. So we had in total £1.9 million worth of income in the last financial year, and our costs were almost 1.8 million, which meant that after we allowed for the investment recovery, so the investment increased in value back from where it had fallen in the prior year when the pandemic hit us, to have a surplus for the year, which also allowed then our reserves to recover from where we were when we were first hit by the pandemic. We reduced costs where possible, so we didn't have any events during the last year. We had less travel costs where possible. This wasn't for our nursing team and people, because that carried on as normal, but for other travel, we found different ways of working. We invested in IT and new ways of working, which also helped to reduce some of our costs. And as I mentioned earlier, our investment recovered. So that allowed us to have a small surplus at the beginning of the year before the investment growth, which allowed us to enter the new financial year in a much stronger position than we were at the start of it. I've got another slide here just to show you the makeup of our income over the last year. This changed quite a lot from the year before due to the emergency hospice funding. But we're also fortunate in our donations and grants and our retail income, along with the grants that we got and the investment income. And again, for the last financial year, our majority of our spend was on our charitable activities, so it went directly back into supporting our patients. We have our expenditure on retail and fundraising, which brings back income into the hospice, and then a very small amount, which is on managing our investment to make sure that we can look after the gift that we received historically. And the last graph that I just wanted to show you here was a breakdown of our reserves for the year. So in the blue, we have our original gift, which we invested. And in the orange is the growth of that investment over the last 3 years. And our restricted income in the grey, so it's a small amount of our income that is restricted, that's carried over to the next year. And then we have slightly more than in our unrestricted funds, which enables us to move forward to the next year. And that's all I wanted to highlight as part of this, but I don't know if there's any questions before we move on to Richard for myself. I'll assume not. So if I move on to Richard, that's okay.
Thank you, Heather, and thank you, Ms. Kent. Good afternoon, everyone, and thank you for inviting me to your AGM this afternoon. As Ms. Kent said a little earlier, my name is Richard, and I represent the auditors of the Hospice, Bacon Oil Chartered Accountants. We have audited the accounts of the Hospice of the Valleys for the year ended 31st of March 2021. The accounts that Heather has just given you a brief glimpse of. I assume that you've all had access to the full accounts. Thank you to Heather, who has just given you an overview of the financial position of the organisation. Don't think that I can add much to that, but if anyone does have any questions about any specifics in the accounts, then I shall be pleased to try to answer. From an audit perspective, this year we carried out part of this audit remotely, but unlike last year, we were also available to visit your premises in Ebbw to carry out part of the audit fieldwork. Some weeks ago, I met with members of the audit committee and reported our audit findings to them. I'm pleased to say that during our audit, we did not encounter any significant issues whatsoever, and the matters that we reported back to the audit committee can be best described as small matters which just needed to be tidied up on. It was also good to see that audit recommendations from previous years have been actioned, and I would comment generally that we have assessed systems and controls here at the hospice has generally been very good. And we have noted that these systems and controls have been further improved during the current year also. As I mentioned, we did not find any significant issues during the audit and therefore intend to issue an unmodified audit report, which basically says that, in our opinion, the accounts give a true and fair view of the charity's affairs as at the 31st of March 2021 and its income and expenditure during the year. Also, that the accounts have been prepared in accordance with UK accounting practice, and also that they have been prepared in accordance with the Companies Act 2006. As part of our audit work, we also have to consider going concern, and that is whether we consider the charity will have sufficient income and reserves to enable it to continue its operation for the next 12 months at least. I am pleased to say that we have no concerns in this regard, while also noting the support to the organisation that the Robin Judah portfolio provides. It is pleasing to see that the portfolio has bounced back strongly from its nadir at the start of the pandemic. I'm also saddened to hear of the death of Robin Judah. We are unable to sign the audit report until the accounts have been formally approved by the trustees, and as soon as we are aware of such approval, then we will be happy to sign the audit report. That's all I have to say. Does anyone have any questions at all with regards to the accounts or maybe the audit process?
Rachel, has anybody put any?
No questions in the messages box.
No.
Okay.
Okay.
If there are any questions that comes to your minds later on, maybe then if you could just forward them to me through Rachel, maybe, and I'll be happy to provide a response as quickly as I can. If there aren't any questions, can I just please finish by thanking Heather and her team at the hospice for the assistance given to my team during the course of our audit. So thank you.
Thank you, Richard. And for the second year running, we're just very grateful for the thorough way that you conducted your audit and reported back to both myself and the board following the completion. Thank you very much.
Thank you.
Any questions anybody wishes to raise with Heather? You're being let off lightly, Heather. And you, Richard. Okay, well, thank you very much. So what we need now from trustees and members is for you to agree to the adoption of the accounts. So would you like to show your support, your agreement with this by raising a hand?
Andrew and Matthew Parker. Andrew Richard and Matthew Parker, yeah.
Okay, thank you very much. Thank you. If we move on to item 4 of the agenda, which is the appointment of auditors for the forthcoming year. And the proposal is that we once again appoint Baker Noyle accountants. Would members or trustees show their support for that proposal? Okay.
Andrew and Andrew Richards, Alan Williams, I have, yeah.
Thank you very much. Would you like to, was anybody like to second?
Somebody should. Oh.
Right, okay. Does anybody like to second that? Thank you very much.
Yeah, I have Alan Williams and Andrew's fine.
Lovely, thank you, Rachel. If we move on to item 5, it's the Chief Executive's overview for 2021. Grant, over to you.
I'll just share my screen for a quick presentation. Thank you. So this is slight following on from Sue's introduction as well. So it's a review of some of the last year's activities for the financial year. A lot of these are going to be numbers, but I doesn't mean that I ignore the fact that behind the numbers are families and patients and carers who've been affected by both their diagnosis and by the effects of COVID and the restrictions over the last 12, 18 months as well. But it's just going to be useful for us to have a look at how we've acted over the last year. We've done our best to keep a business as usual attitude and try and get and support as many people as we could. And I think we've succeeded in that over the last year. And that's, as Sue mentioned, that's due to the sort of dedication and compassion of our staff and their attitude to getting out. And also us as an organisation being organised enough to do that as well and support them. So if we go through some of the numbers. So over the last year, or the last financial year, then we supported 764 patients within Viney Gwent. Now, we're not the best at recording the support we provide to carers, but we've looked at the figures and we think if you include carers or family members and those we help as well who are living with and supporting and helping patients, then we're looking around 3,000 people a year we're supporting, which works out about 3.2% of the population of Viney Gwent. So there's a good chance we've reached into many houses over the last 30 years. There's a lot of households across Viney Gwent we've reached, a lot of relatives we've touched. I think that's reflected on our board and amongst our supporters that many of those are involved with the organisation because of the support they or their relatives has received during this time. So we're not insignificant in our role within the local population. We do have a reach and we do have a context, and we think we have a valuable part to play. We've always talked about ourselves as a community resource, and part of the community, we were started by members of the community who just wanted to get a service delivered and created for the local population. We hope we continue that in terms of being in the community and with the community as well. If we look at the patient breakdown through the year, then we had 525 new referrals during the year, 400 people we supported during the last days of life, and we discharged 138. Again, behind those numbers, if we think about the referrals, the majority of those, about 36%, were referred directly from hospitals, and around 15% were self-referrals from relatives or patients, further 15% from care homes, and a further 15% from GPs locally. So looking around at other figures from other hospices, I think we've got quite a high proportion of self-referrals. And I think that's a positive for us in terms of people know where we are, what we do, and they can refer in. Obviously, that process involves us contacting health professionals to get a background and diagnosis to support them. But the fact we're there and people can approach us is a feather in our cap, I think, as well. In terms of the deaths, it's about an average level of deaths we have each year compared to the last 2 years. But what was different this year was around 11% of those people who died within 48 hours of being referred to us, and 28% died within 1 week of being referred to us, which is higher than previous years. Some of that's been reflected by some of the activities we've had and the support and the engagement we've had with local care homes, where because of the nature of COVID, it wasn't clear that it was COVID at an early stage, so some people referred in the final stages, and our engagement was limited to that time. And indeed, the number of deaths in care homes within Blind and Gwent over the last year was a significant increase on previous years. On average, we have about 237 people on our caseload every week. That's divided up amongst the nurses. We have an East and West team support those, as well as providing holistic service with our bereavement support, welfare rights support, physiotherapy, complementary therapy. So we do reach a number of people. And looking at this figure and previous figures, we're reaching just under about 50% of deaths within Blind and Gwent that we're involved with any year. And last year was a milestone for us, and it's the first time since we were established that we had a higher percentage of non-cancer patients than cancer patients. We had 51% non-cancer diagnosis. A large number of these were related to our dementia diagnosis. This again reflects our work within care homes and also reflects our carry-out service, which is a dementia-specific service offering dementia support throughout Blind and Gwent. But we also have a large number of people with respiratory illness. We have heart failure and other illnesses, non-cancer diagnoses as well. And again, if you look at the figures when we established, it was near 90% cancer, 10% non-cancer. So there's been an active move towards supporting more people and realizing there are diagnoses beyond cancer that need support as well. And the dementia caseload is growing over the last year. We've seen a lot more impact, I think, in terms of our dementia service, partly because lockdown definitely had a strong effect on families living with dementia, both carers and patients, as access to day services and other parts of the health and social care community were limited due to understandable protections of staff, protections of visiting. So of our total those patients who died, we had 68% of patients died at home. And that's compared to a Welsh average of 58% of patients who die within hospitals. So this is a lower figure than you might expect looking at the previous slide, but I'll go into this a bit more. It's just that if we go on to the next slide, we can say that 85% of patients died in their preferred place of care. Now, those two figures may seem counterintuitive. The first figure was a proportion of total deaths. This figure is patients who are able to express a preference. So of the patients who told us where they wish to be cared for or wish to die, then 85% of those patients died in their place of choice. Now, by the nature of referrals coming in and dying within 48 hours and so on, not everybody has the capacity or to express their preferred place. So that's why the previous figure was lower. Of those where we know what their preference is, 85%. We'll see on a later slide that those who've accessed Hospice at Home, which is our service which supports people overnight, for those who access Hospice at Home in the last days of life, 93% of those patients died in their preferred place of care. So we're trying to meet patients' needs as much as we can. And we're trying to find out about patients' needs as early on as possible so we can respect those as well. In the last year, and this may be partly due to the pandemic as well, we had a 28% increase of patients we reported as complex and having complex needs. That's patients with more than one diagnosis, living with multiple conditions, and some indeed psychological support needed as well. And the psychological aspect of that may be linked to lockdown and the COVID restrictions and the general feeling amongst the nation of uncertainty and fear over the last year. But that had a reflection in terms of staff time and staff input. The more complex the patient, then the more interactions they need from us and indeed from district nurses, GPs, other members of the other healthcare professionals as well. And this is reflected in our contacts, which we report. Says it's sort of 15,000 contacts, but what does that mean? That means that 54% of those contacts were face-to-face meetings, which is surprising when I did the figures. There's actually more face-to-face contacts than the previous year before the pandemic. And that's reflected, I think, because of the complex nature of patients. We had a better way this year in terms of rating and assessing patients in terms of need. I think there was a little bit of gap filling in terms of other services not being able to go out as much. For those, it's very important that we had a hiatus on face-to-face for about 6-7 days before we managed to get protective equipment sourced. And we were looking at virtual working, but we realized very quickly without face-to-face contacts and healthcare professionals and others actually seeing patients and talking to them, then there was a higher risk of us not meeting their needs and things going missed, unnoticed, that could have been resolved. But we did 26% of those contacts were with other healthcare professionals. We do work very closely with, as you said, in partnership. We're not an island, we don't work in isolation, so we do support others, healthcare professionals and allied healthcare professionals who are supporting those patients. And if you are a family living with a life-limiting illness within blind event, you will have a plethora of people coming through your door from different agencies and different organisations. And it's important that we talk to one another to make your journey and your experience smoother as well. But we weren't immune to changes, and as Sue said, we did adapt. So within those non-face-to-face contacts, we have used Zoom, we've been supported by the Health Board again to use Attend Anywhere, which is a one-to-one appointment system where you can support people virtually. But we have been out doing a number of visits as well. So we still managed to notch up over 35,000 miles amongst our staff, which is quite considerable if you look at the size of blind equipment. So as an example, we carried dementia service. We moved online for the carers and the patient group to a Zoom group. That was quite intensive to begin with in terms of staff spending time with families, going out to get them logged on and how to use the technology. But that group has worked very well. It's an example where we managed to get support from a local company that sent out cream tea to every family so they could have a cream tea at the same time whilst being online together and sharing experiences and stories. And in some ways, our day centre benefited from being online to a degree. If we had patients, unlike many day centres, I think we had patients who came in and sat in the same chair every week and wanted the same activities and wanted to do the same things, whereas online, it became what we'd hoped it would be in that physically, which was more of a peer support group, people sharing experiences, supporting one another. And in fact, our input for our own staff lessened as time went on. We was a facilitator for them and a space for them to meet and support one another. And in terms of peer support, it worked better than actually in the physical building. So we're looking at how we can continue those kind of things as a hybrid way going forward. The technology is still the barrier in terms of access to it, in terms of we realise we live in an area with enormous health inequalities, challenges and social economic challenges, but where we can support them, we will, and we're looking at how we may support them differently going forward. And indeed, our family support team had a massive uplift in activity this year, and many of that's been over the phone or virtually, which has been appreciated in many different ways. And though there was some scepticism to begin with, we're finding that initial conversations and some ongoing conversations about bereavement, especially with children and younger adults, is easier and more acceptable over the phone. Indeed, with our young persons or children's bereavement support service, we've struggled to have a good attendance at face-to-face meetings. We're now finding that people will access it via the phone. They'll move on to FaceTime, and then once they trust us, they may come to an actual physical meeting. So that's something we probably weren't aware of before, but it's using the virtual technology has helped enhance that service to a degree. And partly because funding from Welsh Government, some of that was ring-fenced to deal with bereavement issues and to open up to patients who weren't, or residents of the local population who weren't hospice patients, but people dealing with bereavement. We definitely had an increase in referrals in the last year. We also expanded, we were funded to offer bereavement support within Merthyr Tydfil, and we've worked with GP clusters over there and their GP support officers to support local population and support them delivering bereavement support. So it was a challenge for our own team in terms of delivering the service online or via the phone as opposed to face-to-face, which can be more intense because you don't pick up necessarily the signals, body language, and also it can be more intense because you fit in more appointments during the day and you don't have less downtime between calls. But we were supporting patients and families who are dealing with suicide or road traffic accidents. So way beyond palliative care patients we were dealing with before. So it's been a challenge. We must commend the team for picking up that challenge and coping with it this year, providing a support to an enormous number of people as well. And that was funded by the Welsh Government because there's a realisation that many people were dealing with bereavement in isolation because of lockdown and so on, and they needed extra support. And that was reflected by some of our contacts within Ysbyty and Iron Bevan, where we have an advanced nurse practitioner based there. And in terms of that hospital, there were COVID wards during the period, and in terms of staff rotation, there were some challenges as well. So we have spent time supporting other healthcare professionals dealing with that change, and especially with Ysbyty and Iron Bevan, our advanced nurse practitioner was often co-opted in and used wisely in terms of the communication mechanism between medical staff and families who couldn't visit their relatives on the ward as well. Partly because we have the experience of having those difficult conversations, and indeed we do training on having difficult conversations for other healthcare professionals. So our hospice at home service as well, we saw provided over 5,000 hours of care and then supporting 104 different families during that period, which is an increase on previous years. Now that we had our own struggles during the year in terms of staffing and shielding and staffing illness, but we've managed to fulfil the CHC fast track commitments during the year. And it's been invaluable. And as I mentioned before, those who access the hospital home service, 93% of those achieve their preferred place of care and preferred place of death as well. So it's been an invaluable service. It's a service that I feel guilty about often neglecting or not mentioning enough, because our paths don't cross very often because the staff are on night shift and I'm in during the day. So when we do have a chance to catch up, it's invaluable to acknowledge the support. And the feedback we get is 99% positive, and it's a real credit to the team, the impact they have on families and the knowledge they get about those families, because even the rest of our staff, we may visit frequently, but we're not spending 7 or 8 hours with the family and the patient to get that understanding of their needs and their requirements as well. So that feedback is essential. Another, because of the nature of the area we're in, it's important that financial worries are dealt with as well. Indeed, for many families, until financial concerns are discussed or resolved or a way found forward to move them forward, it's very hard for people to discuss their own conditions, symptoms, and the medical side of things that need to be coped with as well. So in the last year, our 2 members of staff working with local families enabled them to access nearly £2 million of benefits for their bike rent. So that's through PIP, through Macmillan grants, other entitlements, blue badges, and so on, that they're entitled to, and working with them. And we must thank the local authority for working so closely with our team as well. It's a very good relationship there. And that is one of the worries we can hopefully alleviate when there's so many other worries when you're living with a life-limiting illness. If we can sort out some of the finances, then we can move on to have discussions about other things and plans as well. So it's a vital part of what we do. And many of those conversations were over the phone, but some of them were through through windows whilst our staff sat in the garden, or so we could still have some face-to-face meetings. So we'd covered in PPE to go and have those meetings. So we'd still address those meetings and those contacts in the best way that would support the families and the patients who needed them. And just to reiterate that we are a 24-hour-a-day service as well. So we do visit up till 10 p.m. and beyond 10 p.m. till the next day we offer phone support. And many of that comes to other healthcare professionals as well as their own patients. So we spent 372 hours responding to patient needs, and that 310 of those were spent visiting patients. And we had a 35% increase in calls on the previous year. And this was reflected, I think, again, partly because of the pandemic and access to other services, but also general worries. And palliative care needs and symptoms and worries do not happen 9 to 5, as we all know. And many of them happen in the early hours or late at night. And those concerns need to be addressed. And we hope we're there for those people as well. We're going to continue that service, obviously, as we go. And I say our 310 visits to patients compared to 231 in the previous year. So the demands have grown on the service over this year. And we thank our team who are on that rota every week delivering those services. Just to finish off, to thank again the local population, which Sue has mentioned. They really did step up in terms of raising funds for us, making donations to the shops and coming to the shops when the shops reopened. But they were also innovative in many ways. So this is a small one snapshot that we had when we weren't able to do our 6-mile race with our other events that happened. Then we had a large cohort local supporters, and not only locally, because it was events moved online. We've had supporters from America and Australia raising funds for us as well, because there are online runs and virtual events. So over £20,000. This is a new income stream. We hadn't raised anything through virtual events in any previous year. And people were very creative. There's a 24-hour hitting a punch bag. There was people climbing up and down their stairs to the equivalent height of Kilimanjaro. There's been sponsored people playing children's football team marathons, with tyre flipping. There's been all kinds of things that people taken on board and been very proactive with it to actually raise funds for us. So that the self-referrals and the feedback we get still makes us feel we're part of the community and the heart of the community as well. So we do have work to do going forward, looking at our new strategy, how we engage with people and find out what they need and how we can support them better. But I think we were reassured this year that people were willing to support us and wanted us to continue. So that was a quick summary of the year. And I say there are a lot of numbers there, and I don't forget there are people behind those numbers, but it was a succinct way I could summarise the year. Thank you very much.
Thank you very much, Grant, for a very quick kind of overview of that particular 12 months. And I think it gives a clear reflection as to such an assortment of activities provided by the staff. But I didn't say it earlier, but we put great emphasis on patients and families receiving a holistic kind of approach to care. And whilst obviously Dylan, our medical director, and our nurses and social workers, physiotherapists and complementary therapists play an extremely important face-to-face care, there are so many other people. The kindness provided by a volunteer is so important. The service provided by our chaplain is so important. And so it is providing this kind of complete, that it's not just about the physical needs of patients, but it's about a whole assortment of needs. And I think it's when we reflect on a holistic approach to care, we are mindful that there are still areas that we would like to meet and respond to in terms of the future provision of care. So thanks, Grant. Has anybody any questions they wish to ask him? Rachel, are there any questions?
I'm having a technical problem.
Oh, right. I had it earlier, but so I'm not going to press any more buttons in case I lose everybody. Okay.
No questions. You can hear me, can you?
Yeah, we can hear you, Rachel. Are there any questions that anybody would like to raise with Grant? Nope. Okay, thank you very much. If we move on then to item 6, and it is regret to note that this is certainly the last AGM that one particular trustee will be attending, and indeed another trustee during the year, due to pressure of work that he was facing. Kevin Lines has had to terminate as a trustee, and we will miss very much, particularly the legal advice and support that he provided for the trustee, though we fully acknowledge the demands that were being placed upon him with regards to his business. So we are very grateful, and we wish to acknowledge formally today the work that Kevin provided. And I'd also like to note that this is the last AGM that will be attended as a trustee, possibly as a member in the future, but Alan Williams has decided that he's reached retirement age. I laugh a little bit because I seem to remember quite a few years ago, Alan, being in a retirement ceremony with you as we said goodbye to you from Neville Hall. So this is your second retirement. And once again, we're very grateful for the support and the advice that you've given us over a long period as a trustee. So thank you very much.
Thank you, Sue. I was just counting up. I've done 52 years of service in the health service. It's about time I hand it over to other people on my stint.
But I think you might still be getting a phone call occasionally. Well, thanks, Alan. We've appreciated especially your kind of interest, which I know even within the NHS was very much around strategic planning and development of services. And at one period, I know that Andrew and I were both very grateful for the advice and help you gave us in terms of some issues that we were having with technology. And I know this was particular interest that you had. And so thanks very much. And for me, it's quite a wrench because we've worked together for many years over a long period of time. Okay, thank you. That brings me on then to item 7, which is the appointment of a trustee for members to approve this afternoon. During the year, we interviewed and appointed Nina Holmes as a trustee. Nina really, together with Matthew, really reduces our age profile amongst the trustees. So we're really very glad to have Nina on board. She is a solicitor working within Cardiff, but more importantly is a resident of Blaenau Gwent, and I know has had personal experience over the years where members of her family have been supported by Hospice of the Valleys. So this afternoon, I would just ask if you could, by raising a hand, agree to the appointment of Nina Holmes as trustee for Hospice of the Valleys. Could you indicate? Thank you. Alan?
Oh, Alan Williams.
Yeah.
And second?
And second, Robert James.
Okay, thank you.
Thank you very much. Thanks, Rob. And also item 8 this year, it is, we need to re-elect Sally. Mirando has come to the end of her term of trustee membership, and therefore Sally has indicated her agreement to continue as a trustee. And so again, I would ask whether you would accept the proposal that we reappoint Sally Mirando as trustee for a further term of service. Again, Bob and Matthew, thank you very much. And Andrew, thank you. Today, it's, as mentioned informally before the meeting began, it gives me great pleasure to welcome Rhiannon to our annual general meeting. I was thinking recently, Rhiannon and I go back a long time. I think, Rhiannon, it was your first nurse management job that I appointed you to. And what was particularly interesting, you had considerable input to the nursing services and the community hospitals which existed at that time within Blaenau Gwent. And I have watched the career of Rhiannon as she's progressed over the last 20 or so years through various nursing posts within Wales. And I have to say that it gave me, as Grant knows, extreme pleasure when I heard that Rhiannon had been appointed as the Executive Director of Nursing for Aneurin Bevan Local Health Board. I always appreciated Rhiannon's input at a time that we were undergoing great change within Neville Hall and the North Gwent Health Services. We were moving from being directly managed to being a trust. The emphasis was much more on business styles, much more on reputation. And above all, Rhiannon gave me considerable support as we tried and we worked to enhance the quality of the services that patients within our community hospitals in North Gwent, and indeed Neville Hall received. And so today, it's lovely to have you with us, Rhiannon, and we look forward because not only was I pleased to hear that you had been appointed into your present post, but I was even more pleased to hear that you were going to take the lead as the Executive Director on the board for palliative and end-of-life care. And I also know from my discussion with you this week that you're also taking the lead on dementia. And so believe me, we're going to be knocking on your door. And I am just so pleased and welcome you this afternoon, and we will listen with great interest to what you have to say. So thank you and welcome to Rhiannon.
Thank you very much, Miss Kent. I'm smiling. I can't stop smiling. So thank you very much for that introduction. Pranam da, everybody. I want to start by sincerely thanking you for inviting me to speak at your AGM. Actually, it's an absolute pleasure and an honour. As Miss Kent's indicated, I'm Rhiannon Jones and my role is Executive Director of Nursing with the Nyren Bevan University Health Board. I've very recently been given the responsibility of leading the local end-of-life care board, and additionally I represent directors of nursing across Wales on the National End-of-Life and Palliative Care Board, which is now progressing into the National Programme Board. So over the past couple of months, I've been getting up to speed with the strategic agenda, and both not in terms of just the national picture, but also reviewing the terms of reference of the previous local board, its purpose and form and function. And we've got a new meeting of the revised group planned for next month, which I'm really excited about. So in terms of palliative and end-of-life care, it's obviously vitally important. I know I'm preaching to the converted here today, but the reality is we only have one chance to get it right for people. And when we don't, it has far-reaching implications for people and ongoing consequences. There are a few things that are certain in life, but one thing that is certain is death. It is estimated that greater than 23,000 people in Wales have palliative care needs at any one time. And the number of people dying in Wales at any one time continues to increase, particularly impacted, of course, by COVID. And Grant gave the statistics for the Blaenau Gwent population. If I may, I just want to go back to the founder of the hospice movement, Dame Sicily Saunders. She established St Christopher's Hospice in London in 1967. And she promulgated the culture and discipline of palliative care, recognising that people with a terminal illness required a distinctive approach to care. Sicily introduced effective pain management and insisted that dying people needed dignity, compassion, and respect. She coined the phrase total pain, which included physical, emotional, social, and spiritual dimensions of distress. And she paid systematic attention to the patient narrative, today referred to as person-centred care, and referenced by Miss Kent as she was talking just before me. Sicily's work inspired the creation of hundreds of hospices worldwide, with hospices providing a very special kind of care with an absolute focus on quality of life for people and their families who are experiencing life-limiting illness and incurable disease. Hospice of the Valleys is a very well regarded institution, and certainly from a health board perspective, it has a superb reputation. It is, of course, well valued by the communities it serves. It's absolutely incredible to see that such a small service in reality can have such reach and impact, and which perhaps epitomises that small is actually beautiful. And Miss Kent and myself were having this conversation just this week about the previous organisations that we worked for and how small they were in comparison to the likes of the Nyren Bevan University Health Board, and big often isn't beautiful. So from the time that I've been leading this agenda for an Aneurin Bevan University Health Board, it's evident that Hospice of the Valleys is very positive, and indeed our relationship and our engagement is very positive. I've been personally struck by the innovation displayed by the hospice and its creativity. This has been demonstrated through the presentations that we've heard today. But for me, particularly the Kutch venture and the Cariad service, to name a few, are particularly impactful. If I may, I would just like to now just briefly give you an outline of the position in terms of end-of-life care and its status from an Aneurin Bevan University Health Board perspective. I'm pleased to say that end-of-life care features as one of our top 5 organisational priorities, and it has prominence in our annual plan, which has adopted a life course approach. Priority 5 is dying well as part of life, and the end-of-life care board is one of the 10 areas supported by a programme management approach within the health board, and our agenda includes advanced care planning and treatment and escalation plans, education, training and professional development to include the recognition that somebody is dying and the ability to effectively communicate as such. Care after death and our bereavement support services, and value-based outcome measures and the introduction of care aims aligned to what matters. None of the above will be any surprise to you, I'm sure, but I must add the COVID pandemic has without doubt brought into sharp focus the absolute need for improved bereavement care. The impact of COVID has been absolutely devastating, and never has death had such media prominence and attention. As the executive lead for Priority 5, Dying Well as Part of Life, my intention is to take what is a complex and multifaceted agenda and ensure that as a collaborative, we have clarity about the end-of-life care board's purpose and mandate. We have a clear vision, together with transparent aims and objectives informed by a needs analysis, what matters principles, and of course, evidence. Like Sicily dictated greater than 50 years ago, our approach must be informed by the patient's narrative. As I said at the beginning, palliative care and end-of-life care, we only have one chance to get it right. But we will all be aware of situations where we haven't got it right, and that in reality, there are significant variations in care, and consequently, there is so much more to do in this sphere. Despite growing attention, multiple reports over the years to include the Sugar Report, the Palliative and End-of-Life Delivery Plan for Wales, NICE Guidance, the NICE Audit, just to name a few. I recently received a letter from a gentleman who was expressing his appreciation for the care given to his mother who had experienced a stroke. I'm going to share that letter with you, and there is a purpose, so hopefully it'll be okay for you to indulge me just for a moment. The gentleman wrote and said, "I'm writing to you to compliment Nurse Becky for her outstanding care, diligence, compassion and empathy shown to my brother, myself and all of our family during the time that my late mother was a patient on ward C5 East at the Royal Gwent Hospital. Becky was the lead nurse looking after my mother. My mother had suffered a stroke on the 20th of September and was admitted to the Grange Hospital that day. She was subsequently transferred to the Royal Gwent Hospital on the 24th of September. Nothing was too much trouble for Becky, both in her care for my mother and her compassion and interaction with our family. The explanation of what procedures were going to take place were always clear, and they were discussed prior to them being undertaken. Her caring attitude, both towards my mum and the family, were always evident and greatly appreciated. On occasions, Becky was supervising a less experienced member of the nursing team, and her knowledge, leadership and confidence in doing so was clearly evident. She was assertive in a kindly way when she needed to be, but allowed her colleague to learn when undertaking the task. Becky's kindness and gentleness helped us all through a very difficult and emotional time in our lives, and we will be forever grateful. From her devotion to her role as a nurse, it is clearly evident that it's not just a job for Becky, it's a vocation. I'm sure that within an Iron Bevan Health Board, there are many other dedicated nurses. However, we are so grateful that we had Becky caring for Mum and us when we needed her at a time of such great need. She is a credit to your profession. My thanks to the family are extended to her. I felt so proud to receive this heartfelt letter. But to put it simply, I want that experience for every patient and every family, and quite frankly, nothing less will do. We need a holistic approach. We need skilled staff. We need recognition that someone is actively dying. We need effective and a sensitive communication. We need patient and family engagement. We need compassion, dignity, comfort, positive patient experience and satisfaction. I could go on. But as Hippocrates said, to cure sometimes, to relieve often, and to comfort always. It is often said that dying is the great equalizer. It is one of life's only milestones that happens to every single person, regardless of wealth, status, or situation. Unfortunately, it is well known that we will die, and when we die, it can be far from equal, so it is incumbent upon us to address that inequality. I am very much looking forward to working with and learning from the Hospice of the Valleys so that we get it right first time, every time. I look forward to the future. Diolch yn fawr. Thank you.
Rhiannon, thank you. Thank you very much indeed. And we look forward to working with you. I know it is your intent to visit us in due course, and we look forward to that visit and to sharing in greater detail some of our aspirations. And I think we would, and I'm sure all our staff watching this meeting this afternoon would share in the words that you have just said with regards what you want to see within Iron Bevan and what we would like to see, and to work in partnership with you. You're absolutely right. We only have one chance, one opportunity to get it right, and it's so important we do so. I don't know if anybody has any questions that they would like to ask Rhiannon. I must say I quite like this video business because you're all quiet and you're not asking questions. So is there anybody? Jane, you usually have something to say. No?
That was lovely, Rhiannon, and it really resonates with us and what we believe in here. You know, there is only one chance to get it right. And I think we've got to learn from our mistakes as well. Absolutely. Sometimes even we don't always get it as right as we possibly could. And I think the answer for me is always working in partnership. Yeah. And one hand's got to work the other. So that's always important. But thank you very much. I was quite moved by Becky.
Yes, indeed. Dylan, have you any comment that you would like to say?
I think that patient letter really is, you could read 100 reports and there are many of them from NICE, and you quoted NACEL, but that letter really, I think, summed up everything that's required. And as you've said, nothing less really should be acceptable. That's what we should be aiming for every time. Thank you. I really enjoyed listening to that.
Thanks, Dylan. Thank you very much. And I'm sure that Dylan and Jane particularly will look forward to working closely with Rhiannon in the future. So thank you. And that brings me to the end of our annual general meeting for this particular year. I would just like to say once again a big thank you. I thank you particularly this afternoon to Rachel, our secretary, our administrator, who has really been behind the scenes, pressing all the right buttons and making sure that this meeting took place virtually. And I'm very grateful for all the rules and guidance she has sent me so I knew what I think I knew what I was doing until I did partly miss a bit of the meeting by pressing the wrong button. So thank you to you, Rachel. Thank you to Grant and Dylan, Heather and Jane. You are our executive team, and I am well aware of the leadership that you've provided over these last 18 months. And I know that our staff have always felt and have known that you've been there, and you've certainly shown your presence within the office and out and about. And in fact, we got quite used to seeing Jane in her scrubs. And that is good leadership. That is good leadership. So thank you very much, the four of you, for really providing leadership, providing guidance, because whilst all this COVID has been going on, life hasn't stopped. And we've continued to work in terms of developing a new 5-year strategy for the hospice. We've coped with so many other issues in terms of changes in IT systems and information gathering and all kinds of things. We've been mindful of changes that have been going on, both this side and the other side of the water, in terms of the way in which the NHS is going to be reorganised, and priorities such as Rhiannon has mentioned, which have emerged either from the All Wales End of Life Board or indeed the priorities which have been identified by Aneurin Bevan. And so all this has gone on at a time of considerable change, stress and difficulty. But I am just so proud, as I know my colleagues are, to have been associated with the hospice this past 18 months, and to be aware of how people have risen to all the problems and to all the opportunities, actually, that have presented themselves to us. So a big thank you to you for your leadership, and a big thank you to the staff working within the organisation. I think we've said it on several times. As the Board of Trustees, we are grateful and we acknowledge the work that you have done and you are continuing to do, because we're certainly not out of the woods yet. And still, we have to be very mindful in terms of the pressures that we are facing, or certainly our care sector is facing, and indeed the health service. So thank you for attending this afternoon, and I look forward to seeing you all this time next year. And hopefully we will be meeting face to face. So thank you very much. Bye-bye.